Good afternoon, everyone. I'd like to welcome you to today's webinar, How to Have Effective Doctor Appointments, Tips for Preparation and in the Doctor's Office with the Ehlers-Danlos Society's very own Shani Weber. My name is Sarah Gerici. I am the volunteer coordinator at the Ehlers-Danlos Society, and I'm your moderator today. This webinar is part of our ongoing series, Living with EDS and HST. So this is how today's webinar is going to work. As usual, all webinar attendees will be muted at all times during the webinar. If we have time at the end of the webinar, Shani will try to get to as many of your questions as possible. So what that means is that at any point during the webinar, you are able to type any questions you may have into the question box at any time. And please make sure you're submitting them to the question box and not the chat. I cannot guarantee we will see your question if you put it in the chat. If you need help finding the question box, send me a message and I will help you find it. Shani will not be able to see or respond to any of your questions until the end of their presentation. Please don't send your questions more than once. It won't increase the likelihood that your question will be answered, and it will only make it harder for us to sift through the questions to make sure we get to as many as possible. Now, after spending many years as a special education teacher, Shani Weber had to step back from teaching due to hypermobile EDS and became a volunteer here at the Ehlers-Danlos Society in 2012. Since then, Shani has done some wonderful things to benefit the EDS and HST communities and is now on staff as our Community and Advocacy Director. Not only does Shani moderate Inspire, which is the Society's online support community, but she also assists patients and doctors from around the world that reach out to our helpline. Along with those two roles, Shani is also a patient advocate and speaks with our national and state government representatives and the medical community about EDS and other issues that our community faces. In addition to all of that, Shani co-founded and co-leads the Maryland EDS group. And I personally have the honor of working alongside her co-leading the Junior Zebra program. Thank you so much for being with us today, Shani, and thank you so much for bringing this webinar to the community.
I am so grateful to be here, and I must give a shout out to S. Joe, who is just a joy to work with. I do have to apologize as my dog was barking. That's one of the wonders of working from home during this time. All right, so we're going to talk today about how to have effective doctor appointments. And a lot of how you have an effective doctor appointment is about the preparation you do before that appointment ever happens. In this presentation, I'm going to talk about how to have reasonable expectations. What are reasonable expectations, in fact? We're going to go through how to collect data of what you're feeling, as well as what treatment options you are trying out and how those are working. How to create a goal for your appointment. That's important to getting the help you need. And then preparing an appointment agenda for each of your appointments. This is how you're going to keep the appointment going on a schedule and making sure that your needs are getting met. And then I'll provide some tips of how to communicate better with each of the doctors on your medical team. Preparation is really important if you want to have effective doctor appointments. You need to think about what you can collect, what information would help your doctor give you better care. The first thing you need to think about in that is to have reasonable expectations. You know, if you're going to your doctor, it's not really reasonable to say, I want immediate access to my doctor, or I want my doctor to run hundreds of tests until the answer is found, just like Dr. House on TV does. It's also not a reasonable expectation at this point in time for every doctor that you see to be an EDS or HST expert. We're still at that time in history where we're needing to teach the doctors we see about our conditions, and where often we know more than our doctor. and in a lot of cases. Reasonable expectations include, I want my pain low enough for me to be able to function. You know, so often we can't be pain-free, but we can manage pain low enough so that we can function. And so learning how to do that. A reasonable expectation may be understanding there's not a cure yet. And so trying to figure out how to better manage the symptoms you have. Or understanding the limitations of modern medicine. You know, not every pill will fix you, not every surgery will fix you. And so thinking about everything in terms of management as opposed to fixing or cures. Having a reasonable expectation for your appointments, for your doctors, for the care that you can get, can lessen your frustration, but can also see where you are making progress, and help you understand that the care you're getting may be already pretty good. For any appointment you're going to, you want to develop an appointment goal. This goal, it's decided by you. It's the reason that you're going to this appointment. Why do you want to see your doctor? What's going on? Your goal is going to direct how that appointment goes, what the topic of conversation is. So think about, what is it that you want to get out of this appointment? Are you looking for images or testing to be done? Or are you wanting to trial a new medication? Or maybe you want advice about braces or other mobility aids. Do you want to discuss the treatment plan to see if it needs to be tweaked? Or maybe you're looking for a referral to a specialist, or to have disability benefit paperwork filled out, or for a parking disability badge filled out. Whatever your goal is, that's going to determine what data you need to collect before the appointment. Whatever your goal is going to determine what you talk about with your doctor at your appointment. You need to collect data before your appointment. You can do this through a symptom diary, charts, graphs. You can use a symptom tracking app. There's many different ways that you can collect data, but you're going to collect data to help both you and your doctor to see what trends of your symptoms there are, and what triggers. For instance, do your symptoms always get worse after you eat? Or do your symptoms get worse when it is a rainy, stormy day? That kind of thing. Collecting data is also helpful when you are trying to justify the need for testing, or for providing for support for needing physical therapy or braces or a mobility aid. Because the data that you collect can show how your symptoms are impacting you, impacting your life, impacting what you can do and what you can't do. It takes time to collect data, it really does, but it's important to do consistently because of the benefits of how it can help both you and the doctors you see, help you get the best medical care that you can. When you are collecting data, it's good to record everything that you are concerned about. For instance, if you're having headaches, you want to track how many headaches you have. Where are they in your head? How often do they happen? On a pain scale, how painful is each one of them? You want to also include what makes your symptoms worse. Does drinking certain things or eating certain things make it worse? Does a falling barometer make it worse? Does doing activities where you bring your chin to your chest make it worse? You also want to keep track of what you're doing to treat that headache, and how well or not it's working. So let's say you are using heating pads on the back of your neck. You would want to keep track of when you're using these heating pads, and keep track of how is that helping? Is it not helping? Does it help some things but not other things? Keep track of that. This can help you and your doctor know what treatment options are working and what they're not working. This data can help you and your doctor determine how life impacting your symptoms are. This is an example of a symptom tracking chart. You can do it old school with a piece of paper and your pen or pencil. Notice that you would want to keep track of the day and time that you're recording this and what your symptom is. You want to pay attention to what you were doing right before the symptom got worse or flared. Did you take medication or do some other treatment option? If so, what was it? But record also, how did it work? Did it? And then any other comments or side effects or anything you want to add to that. There's lots of different charts you can find on the internet that you can just print out, or you can create your own. Everything from headache charts to pain charts to symptom charts specific to gastrointestinal issues and so forth. So if you'd like to be old school and do pen or pencil and a sheet of paper, you can certainly do that. Whenever you're collecting data, it's really helpful if you can turn it into a graph, because your doctor can see what your data is telling you very quickly through a graph. This may be a bar graph, a line graph, a pie chart, anything that would help at a glance you and your doctor to see what's happening. How often are you having headaches, or how well is the treatment option that you're trying working? How well is that medication working, for instance? This is just an example of a multi-line graph. Notice that it shows a line for pain, a line for swelling, a line for mobility. I presume maybe how they were able to walk or get from point A to point B, as well as a lower chart for treatments. How did each of those work? You can see that the cold cure for this person seemed to work in the beginning, but went down very quickly. Whereas the BFST, whatever that might be, kind of helped some and not some, and but very quickly you can look at the data that was collected and how your symptoms are going and how your treatment options are going. If using apps on your phone is more your speed, these are just a few of the many. I will say that these are often the ones that are rated most highly for you Apple people and for you Android people. For some apps, they're the same option on both iOS and Android, while other options are only available on iOS or Android. And so you can explore those for what app you're most comfortable with, what's helpful. The value of using an app is that many of these create graphs for you that you can share. Some of these apps, you're able to send them directly to your doctors. You can show them on your phone at your appointment, or you can even print the graph or any of the symptom tracking pages that you want. And so not only are you collecting your data, but it's providing an easy way for you to share that information with your doctor. These are just two examples of apps. Simple and Can't Catch My Pain are available on both iOS and Android. but you can see how different apps look different. They collect the information differently. And so you really might want to go through different apps and see which ones you feel most comfortable with. I know a lot of people right now are looking at this one with the human body and looking at that edit pencil right there and thinking, I could color this whole thing red from tip to toe. How many of you are thinking that right now? So why track these symptoms? Yes, it takes time. You know, you've got to be consistent. Why should you spend that time? Well, the Pew Institute did a research study that tracked people who were collecting data about their symptoms. And about 40% said that it led them to ask a doctor a new question they hadn't thought of, or led them to seek a second opinion, as they weren't sure what their doctor was saying was going to be accurate for them. 46% say that this activity of collecting data changed how they maintained their health. Through collecting data, maybe they found that one or more of the treatment options weren't as effective as they thought that they were, for example. Or it may be that through collecting data, you are able to determine what is triggering your symptoms getting worse. And maybe it's something that you can avoid. We can't avoid the weather, but we can avoid eating a certain food that we may react to. And so collecting that data and looking at that data over time can help you determine what is helping, what is triggering these symptoms, how frequently are you having these symptoms, how are these symptoms changing over time. And so just over a third of trackers said it affected a decision about their treatment. And so there's lots of reasons to collect data and to track your symptoms. And if you're not doing it, you're really missing an easy opportunity to improve your health care. For every appointment, you need to create an appointment agenda for each appointment you go to. On your appointment agenda, you want to write out your appointment goal. You want to include what medications you're taking and any relevant history to that appointment. So it won't be your entire medical history, but if you're going to see your doctor, for example, about your painful knee, then relevant history may be that you have had recurring knee issues since you were a teenager, and that you had a surgery, a partial replacement of your knee 5 years ago. Whatever is relevant to that appointment. If your appointment goal is to have, to look into treatment options for your knee pain, then the relevant history that you provide is history related to knee pain. You want to briefly write out what the timeline of your symptoms are, and any new symptoms that you're having. So how long has this been going on? As well as what you've tried for treating it and how that's worked. You don't want your doctor suggesting things that you've already tried and found didn't work, right? And so your data can show that it doesn't work, but you want to include that on your appointment agenda. Be sure to also include any lab tests, samples that you have, pictures you've taken, or a short video you've taken of any symptoms that you're having that are what you're talking about at today's appointment. This is a sample appointment agenda. Appointment agendas are things you can write out yourself if you're wanting to do it by hand with a pen and paper. You can type this out on a computer, or there's templates that you can find and fill in. On your appointment agenda, you want to have the date of your appointment, what doctor you're seeing, as well as what vitals are they taking? Are they taking weight, blood pressure, heart rate? If they are, have that on your agenda so that you can fill it in at your appointment to keep. You want to write out your goal. For instance, in this example, determine the cause and review treatment options for increasing dizziness. You want to list any diagnoses you have. This person has hypermobile Ehlers-Danlos syndrome and osteoarthritis. You want to list what current medications you take. But you also want to include what vitamins and other supplements you're taking. This is very important because many vitamins and supplements interact with medications. And so your doctor needs to know not only the medications you're taking, but also the vitamins and supplements that you're taking. So list those out. And then you want to list any new issues since the last appointment you had with this doctor. So in this example, I'm becoming dizzy as many as 7 times per day, especially when standing for more than 10 minutes. I reported these same symptoms to my pain management doctor, Dr. Jones, on January 16th, 2020. And so in this example of new health issues since, notice it's not just I get dizzy. What you're writing is, what are you experiencing? How often is it happening? What makes it worse? And additional information. And then in the next section, your treatment that you tried and how that's working. So this person is consuming more fluids per day. They're salting their food. They're wearing compression hose, but they're still getting dizzy. And so that tells the doctor, yeah, what they've tried has not worked. You want to leave a place for notes, what you talk about during the appointment, but you should also list out what questions you have. It's very easy to forget questions during the appointment. So you want to write your questions out whenever they occur to you before you ever get to that appointment. In this example, they want to know, should I buy a blood pressure monitor? Can the doctor recommend one? When should I seek emergency care with this dizziness, right? Now here's the same appointment agenda, but the person is just finishing their doctor's appointment. They filled in the weight that was taken during the appointment, the blood pressure and the heart rate that were taken before they saw the doctor. Notice that notes were filled in. Dr. Smith wanted this person to increase their sodium intake to 2,000 milligrams a day, and to continue charting how often and what this person is doing when they get dizzy, as well as how much fluid they're drinking, how much sodium they're taking. And Dr. Smith wants this person to let both her and Dr. Jones know how this is all going after 1 month. Look down in the questions section. This person asked, should I buy a blood pressure monitor? Dr. Smith said yes. They also asked, can you recommend one? Dr. Smith said that Amaron is a good brand. And when should I seek emergency medical care with my dizziness? And Dr. Smith said if they faint, then you should seek emergency care. But look, here's a 4th question. It's okay to come up with another question during the discussion you have with your doctor at your appointment. If something else occurs to you, write out the question and then write out what the answer is so that you can look back at it later. How can I consume more salt? And Dr. Smith said, use Thermotabs or Noon tablets or electrolyte drinks. Some people drink pickle juice. And so you can write another question that occurs to you at the appointment. So at your appointment, you want to provide a copy of your appointment agenda to your doctor and keep a copy for yourself to write notes on, but also for your own records. By giving a copy to your doctor, you're allowing that doctor to follow along during the appointment, but they'll also put this appointment agenda into your medical records. At your appointment, verbally say what your appointment goal is at the beginning of the appointment. Why are you there? And share any of your data, particularly if you can get it into a chart or from an app to make it more readable quickly for your doctor. The appointment is just not long enough for them to go through pages and pages of data. So do what you can to make that data viewable in just a very quick glance. When we are not in a global pandemic, you can bring, and we can actually go to doctor appointments. It's okay to bring a family member or a friend as an advocate or an extra pair of eyes and ears. You know, sometimes we have brain fog. And sometimes we can't remember everything that was said or what we want to ask or what's going on with us even. And so having someone with you can help you remember what else the doctor said, but can also help the doctor better understand what's going on if you are not able to articulate it very well. Definitely take notes during your appointment, or even ask the doctor if they're all right with you recording the appointment. It's just way too hard to remember everything that's said. It's okay to ask questions at your appointment, but really just limit it to a few for a more effective appointment. There just really isn't enough time to ask 10, 20, 30, 40, 100 questions. So think about what your appointment goal is and ask a few questions related to that appointment goal. When describing to your doctor what's going on, make sure that you are being very specific. You don't want to say, I have headaches, because that doesn't really help your doctor understand what's going on. You want to describe the nature of the symptoms, how often it's happening, and how it is impacting you. So instead of saying, I have headaches, you could say, in the last month, I have had 7 headaches, all at the base of my skull with stabbing pain above my eyes, which disrupted my sleep and my ability to drive. So instead of just saying, I have headaches to the doctor, you are giving that doctor the information of over the past month, how many headaches I've had, where it's located in the pain. I describe the type of pain that I'm having, stabbing, and I also included how it's impacting me. It's impacting my sleep and my ability to drive. You've just given your doctor a lot of information in that one sentence that can help both you and your doctor determine what is going on and what to do about it. At your appointment, remember, doctors are experts of the human body, but you are the expert of you. So you're coming to this as 2 experts sitting at the table together, giving respect to each other for their own expertise. You're not at your appointment for validation. This isn't a time really to bring all of your emotions. This is really a time to discuss your data, discuss what's going on. It's really a time for problem solving. And so the focus of this appointment, instead of validation, needs to be on problem solving. You have a problem that you are there at the appointment for help with. and what, in terms of your appointment goal, do you want to leave there with? Remember, are you wanting more testing? Are you wanting to be referred to a specialist? Remember, developing your appointment goal. You want to problem solve the problem you're having. Be a good time manager, and that's why you want things like, how can your doctor look quickly at your data during this appointment, which isn't very long, right? Be open to try different treatment options. If you say no to everything that the doctor offers or proposes, then the doctor's toolbox is empty. And so it needs to be a discussion of which treatment options you're willing to trial. Now, this is a new section I've added. During COVID-19, we are seeing a great increase of telemedicine appointments. It is my fervent hope that even as we come out of this, that telemedicine is still going to be widely used. I think it can help many of us who are living with a disability if we had greater access to telemedicine appointments. Here's the thing. You need to prepare for telemedicine appointments in the exact same way as you do for your in-person appointments. You still want to create an appointment goal. You still want to collect data of what's going on and what you're doing to treat your symptoms and how that's working. You still want to create an appointment agenda for your telemedicine appointment. All those things you do to prepare for an in-person appointment, you want to do for your telemedicine appointment. If you are in the United States, you need to check with your health insurance company to see if telemedicine appointments with your doctor, with your physical therapist, with a mental health professional, or any other provider are covered by your health insurance plan. Some insurance companies are covering these appointments and some aren't, so check with yours. Make sure you have as good of an internet connection as you can, and turn your volume up so that you can hear what the doctor is saying. And make sure you have your appointment agenda ready with you, as well as whatever collected data. You can even, through your patient portal, or if you have your provider's email address, send the doctor or other provider your agenda and your data that you've collected with your graph or chart or report for them to look at before the appointment. So maybe send it a couple days before or the day before, morning of. Also, make sure for your telemedicine appointments that the area you're in is quiet, or as quiet as can be. Have your paper and pen handy so that you can take notes. Remember, it's hard to remember whether you're in person or on telemedicine. It's hard to remember everything, so be ready to take notes. Ask your medical provider on your telemedicine appointment if it's okay to have your family member with you, if that is something that you want. Remember that not all patients are technology experts, but all doctors and other providers are also not technology experts. So be patient. If you are more savvy with technology than your provider, we are all learning in real time how to do this. And so whether you're a school teacher trying to suddenly learn how to do distance teaching, whether you are a teleworker figuring out how to do your job from home, or whether you are a patient who now needs to get medical care through telemedicine appointments, or you're a doctor needing to provide medical care through telemedicine appointments. We need to be patient with each other as we learn this new way of doing things. Go ahead and discuss with your doctor a plan. When should you be seen in person? When should you go to urgent care? When should you go to the emergency room or the A&E if you're in the UK? Have a plan discussed with your doctor so that you know when you need to seek further care. I asked quite a few doctors about telemedicine in this last week of what would they like patients to know and what challenges are they experiencing. A general consensus, they want you to understand that the appointment is best for documenting what's going on. While there are guidelines for how to examine a patient virtually, a lot of doctors are new to this and they are not skilled at it yet. And so what's happening in a lot of telemedicine appointments are good discussions, but also good documenting of what's going on. So in this time, when you're doing telemedicine appointments, it's even more important for you to collect that data so that that documentation can get into your medical record. The doctors asked if you're able to take some of your own vitals before the appointment starts that you could share with them. The types of vitals that they take when you are there in person, for instance, if they weigh you, if you have that ability at home, maybe you can give them that information. If they take your blood pressure or your temperature, if they take pulse ox readings or glucose levels, if you have diabetes, whatever vitals they take before your appointments, if you're able to, if you have the equipment at home, they ask if you go ahead and take your own vitals and share that information at the appointment. And they also ask that you keep focused on your appointment goal. Apparently, a number of these doctors are getting tours of the remodeled kitchen or the newly finished basement or other parts of the home during the appointment. And they're kind of feeling like, we need to talk about your symptom that's getting worse. And so just like I'm advising everybody for getting better medical care is to create an appointment goal. The doctors are asking at this time of telemedicine that we and they can stay focused on your appointment goal for the appointment. There's pros and cons with telemedicine. You know, right now we're needing to do a lot of telemedicine appointments. And they're great for saving time. You don't have to drive to your doctor, and you don't have to wait in the waiting room. And that's particularly good during a global pandemic, as we don't need to go to the medical center where we might be exposed to COVID-19. This is also giving a unique opportunity for some people to see doctors that they normally have to travel across the state or across the country to see. And so this is a great opportunity to see some of those doctors virtually instead of having to commute that far. There are cons to this as well, though. They aren't able to do an effective exam of you. And so it's kind of a mixed bag. You might be able to receive better care with some things in an in-person appointment. They're able to examine you and such. But on the other side, you've got the doctor's undivided attention in a telemedicine appointment that you may not have at an in-person appointment when other staff members may be coming into the room with a question or something. Let's briefly talk about the emergency room or the A&E if you're in the UK. The role of the emergency room is to stabilize patients. The emergency room and A&E staff want to either refer you back to your doctors or admit you to the hospital. They want to stabilize you so that you can go back to your local doctors or be admitted to the hospital and out of the emergency room or A&E. That's their job. Their job is not to necessarily investigate all possible causes of a new pain or symptom. There are definitely times to go to the emergency room. If you're having chest pain with vomiting or shortness of breath, sudden and sharp abdominal or chest or pelvic pain, if you all of a sudden are bleeding or you can't get bleeding to stop, if you're having difficulties breathing or with circulation, blood circulation in your body, if all of a sudden you're slurring your words or experiencing partial paralysis or suddenly have lost all your vision, or a sharp flank pain, and obviously if you have a broken bone. These are just some of the many reasons why it's important to go to the emergency room, to the A&E. But there's other times that there's not a good reason, where you can schedule an appointment with your doctor. For instance, if your symptoms can wait for you to see a doctor later that day or the next day or that week, you probably don't need to go to the ER then. Or if you know what the problem is, but you want the ER to give you pain medication, that's not a great reason to go to the ER, because as many of us know, the emergency room has really cut back on providing pain medication to patients in pain. They are leaving that to the local doctors or when they're admitted into the hospital. Don't go to the ER if your doctor has not figured out the problem yet, and so you're just hoping that Dr. House, who's a TV doctor known for performing million-dollar tests, hundreds of tests, until figuring out the exact reason something is happening. Unfortunately, there is not that doctor in the ER. And another one that I see, if you're well enough to go onto Facebook and ask, should I go to the ER or A&E? You probably don't need to go to the ER and A&E. Let's say you are being admitted into the hospital. Remember, right now under COVID-19 guidelines, most people are not able to have a family member with them. But when that is permitted again, it's good to have a family member with you so that they can be your advocate. Make sure you bring your list of providers, your medications, what surgeries you've had or other treatments. Make sure you bring things you like to do. Do you like video games on your phone, or a book that you can read, or maybe you knit? Bring comfortable clothing, a favorite pillow, your health insurance information, your family members' emergency contact information, and don't forget your charger. Make sure your charger comes with you. We need to make sure that we're remembering our regular checkups. Not everything is due to EDS. We need to have annual physicals. We need to go to the dentist and have eye exams and get our vaccinations. We need to know about our bone density as we age. We need to have our annual gynecological or mammograms or colorectal exams, and checking cholesterol, blood pressure, all of those things that every human is prone to having issues with. We are not protected from inheriting, acquiring, or developing any other health condition. I ask you, please do not assume every new symptom, every new pain is due to EDS. I am still heartbroken. Two very important people to me in our EDS community who were super knowledgeable about EDS and HST, who helped thousands of people living with these conditions. Both of them, not at the same time, it was several years apart. Both of them experienced a new pain. Both of them assumed that pain was a new EDS pain. Oh, I always have pain, there's a new pain. Both of them, by the time they went to the doctors, were diagnosed at stage 4 cancer. It was not caught early because they assumed this new pain, these new symptoms were due to EDS. So they ignored it. As you may know, stage 4 cancer is the last stage. It's when it's much harder to treat successfully. And sadly, both of these strong women lost their lives to cancer. I beg you, please do not assume every new symptom is due to EDS or HST. Share your EDS and information at your appointment with your doctors. What I tend to do, for instance, if my appointment is about gastrointestinal problems, I will bring articles from PubMed or Google Scholar about gastrointestinal issues in those that have a type of EDS and HST. We also have medical journal articles on our website at Ehlers-Danlos.com, and I'll bring those too. So tailoring what articles I bring, I'll bring general EDS and HST information, articles and brochures when I'm first meeting a doctor, but I'll bring specific EDS and HST articles and brochures that match my appointment goal. And over time, then we're creating our own EDS and HST experts. On our website, we also have posters that you can ask your doctor if they are willing to put in, hang in their lobby. We have wallet cards available that you can keep in your wallet. These emergency handle with care wallet-sized cards. I went ahead and laminated mine so that it lasts longer. Important to stay organized. You're going to be making these appointment agendas that you want to keep. You have your medical records, which I recommend you getting from your doctors, ordering a copy every so often so that you keep your own medical records for when you need them, as well as keeping your EDS and HST articles and brochures organized. There's different tools to stay organized. My medical is one way. Backpack Health is another way. Google Calendar is great for keeping you organized for when your appointments are. Lonesome Doc I love. You can order the full article when you just see an abstract on PubMed. Dragonspeak is great for voice-to-text software, and that's another way to help stay organized when it hurts to type with your hands or wrists. You can do it online, or you can do it with an accordion file and just have all of your papers organized. Share brochures, share articles, create EDS and HST experts out of your medical team. I need you to beware of red flags though. If there's communication issues, or if there's a real condescending attitude, or if they aren't able to answer your questions, or they're unwilling to discuss what your concerns are, or they're not willing to explore treatment options, or they're disrespectful and not respecting your time, you know, these are red flags. Maybe you want to fire that person and get a different doctor for your medical team. Not all doctor-patient relationships are productive, and so parting ways may be necessary if this relationship is not working for you. But be aware that any of these behaviors can be exhibited by patients as well. Don't be a red flag for your doctor. These are behaviors you don't want to do also. I'm going to skim through these as we're running close to our time. But tips of what you can do. For instance, lots of doctors have 30-minute or longer appointment slots, maybe once or twice a week, or maybe every day after their lunch hour. So when you're scheduling, try and schedule for these longer appointments. 15 minutes is not enough time to get your needs met. If you can have an appointment earlier in the day, they'll be less behind. So that's less time for you waiting in the waiting room at a time such that we can wait in waiting rooms again, which may be a little while. There's more tips too. Be honest with your doctor. That's the only way you're going to have help. It doesn't help you or the doctor if you're not honest with what's going on, or what you're trying to do to treat your symptoms. Contact your insurance company prior to any treatments to make sure the doctor, the treatment, the medical center are covered. That can save you a lot of stress. Know your rights as a patient. Be sure to thank your doctors, their nurses, the staff members at the reception desk when they provide good service. That's just building good relationships. When you observe someone doing good, thank them for that. Recognize that. But there's a lot of things that we shouldn't do too when we're talking about best practices for patients. So yeah, don't do these things. Don't lie about how you're taking medications or treatment options. Again, that just doesn't help you or the doctor. Don't take it personally if your doctor discusses things like weight or lifestyle choices. They're just sharing what they know about known risks to health. It's up to you to decide what to do with that information. Here's some more don'ts. Don't assume that there's a pill or surgery is going to fix everything. Sometimes PT, physical therapy, will give you a better outcome. Don't expect the doctor to read the articles we bring at the appointment. The appointments are too short. What you are bringing will hopefully be some of their evening reading, their weekend reading. And also consider where the source is for the articles that you bring. Doctors are going to respect peer-reviewed medical journal articles or information from international or national patient organizations. They are not going to respect information that you give them from Wikipedia or from somebody's blog or from a social media post. So make sure you're bringing information from sources your doctor will respect, so that there's a better chance they will read what you bring. I really hope that you get the medical care that you need. Having EDS or HST is not easy, but if we're educated about our conditions, if we build our medical teams with doctors and other practitioners that you trust and you work well with, that you create a good relationship with them, if you prepare for your appointments by collecting data, creating an appointment agenda, by knowing what your appointment goal is, and by being an active participant in your healthcare, you really can get better healthcare than what you're getting right now. I really appreciate you spending this time with me. I hope some of these tips helped you. If you ever want to contact me, you can get to me at shani.weber@ehlersdanlos.com. And of course, there's lots of information on our website.
Alrighty, thank you so much, Shani, for all of your diligent work as usual, not only on this webinar, but every day that you're out there helping our community. We do have some questions that came in if you'd like to get them in now. We'll see how many we can get to. If not, just a reminder that if we don't get to your question, you can reach out to our helpline. You can call or email, and Shani will do her best to get you answers and provide guidance where she can. So the first question that we have in today is, what is the best way to broach the possibility of a hypermobile EDS diagnosis to my regular doctor?
That's a very good question. What I would suggest is that you look at the diagnostic criteria for hypermobile EDS on our website. We have a checklist that you can print. under EDS information, under international 2017 international classification, that section of our website, you can go down to the international classification article that contains the diagnostic criteria for every type of Ehlers-Danlos syndromes, including hypermobile EDS. And so the explanation of some of those diagnostic criteria that you see on the checklist have a better explanation in that article. For instance, for stretchy skin, extensible skin, where do you measure it and how much should it be pulled out to qualify for that criterion in the diagnostic criteria? That kind of information. If you meet the diagnostic criteria for hypermobile EDS, then what I recommend that you do is bring that checklist of the diagnostic criteria for hypermobile EDS and show it to your doctor so that you can demonstrate how you meet this criteria. Chances are very good your doctor does not know what the diagnostic criteria are for this condition, if they know about this condition. But that being said, in general, it's best to get diagnosed in the US, generally by a geneticist. In many other countries in the world, by a geneticist. In some countries, like the UK, for example, it's best to be diagnosed by a rheumatologist. The reason for this is that one of the criterion for hypermobile EDS that has to be met is that you do not have another type of EDS or another genetic connective tissue disorder or autoimmune condition that can cause similar symptoms. As I mentioned, that international classifications article has the diagnostic criteria of every type of EDS. I encourage everyone to look through that article to see if you do meet the diagnostic criteria for a different EDS type. If you meet the diagnostic criteria for another EDS type, well, then that type of EDS has a genetic test to confirm the diagnosis. As you may know, every type of EDS currently has a genetic test to confirm the clinical diagnosis, with the exception of hypermobile EDS, the most common type of EDS, right? It's the type I have. So if you meet another type of EDS, you're going to want that genetic testing to confirm that diagnosis. Joe, is there another question?
Yep, it would probably help if I unmuted myself. But again, working from home, you know, things get noisy when everybody else that usually isn't home is home. So next question is, do you have specific guidelines for seeking pain management help? Are there particular things to look for in a pain management doctor? Are there certain questions I should be sure to ask or information I should be sure to give?
With pain management specialists, they come in so many different varieties. What you want to determine before selecting a doctor to see is what kind of variety they are. Are they providing the type of pain management treatment options that you are seeking? There are some pain management specialists that all they do are injections of different types. There are some pain management specialists who all they do is prescribe medications. There's some pain management specialists who are a combination of both of those. There are some pain management specialists who specialize in Eastern medicine or alternative medicine, or work closely with Eastern or alternative medicine practitioners. While other pain management specialists work closely with orthopedic surgeons or neurologists or some other specialists. And so you want to choose the pain management specialist appropriate for what's going on with you and who provides the treatment options for pain management that you are interested in exploring and trying. In terms of questions or what to bring, it's pretty much a given standard that you'll want to bring at least EDS, what is EDS and what is HST brochures, just to leave with them in case they don't know what these conditions are that we have. But what you're going to talk with them initially about isn't necessarily the EDS and HST as a whole. You're going to be talking about what specifically is hurting, as well as what treatment options you've tried and how they have done, or have they worked or not worked, right? And so it's a matter of investigating what services they provide before you make an appointment, understanding what is important to you, as well as going ahead and interviewing them when you have that first appointment. It may be when you have that first appointment that you two don't mesh, that it doesn't look like it's a relationship that's going to work well. And so it'll be important then to select another doctor and go through the same process. As Joe, I'm not sure if there's a way to, how best to do this, but I did a presentation at the 2017 conference that included how to make your medical team, how to interview doctors, and how to select the different practitioners for your medical team. That would answer her question.
Do you remember if it was recorded? Because if it was recorded,
Yes.
It would be up on our YouTube channel under
Yes,
the 2017 conference playlist.
There's both the video and the slides.
Okay, so that can be located on our YouTube channel if it is available. If it is not available, we can work together offline and we could at least get, if you still have them, the slides available, and we could link them into when we post this one. If not, it is already up on the YouTube channel with the slides if it was recorded. So well, when you answer the next question, I will double check.
I actually know that answer. Recently, we have dropped anything before 2018 on our YouTube channel, and so this was from 2017.
Okay, that is news to me. So we will work offline to see what we can do to get that up and available. Chances are we will link it in the description of this webinar once it is posted. So keep your eyes out there. Alrighty, we're over time. I've got two more questions that are very, they can cover everybody. They're not patient specific. For those of you that we did not get to, please forward your questions to the helpline and Shani will be there to help you and answer your questions anyway.
I answered the helpline emails, and our wonderful colleague Rebecca answers our helpline calls.
Yep, so between one of the two of them, they will get your question answered. So one of these is kind of COVID related. I have an appointment to see a TMJ specialist, spent a lot of money. Doctor does not have adequate protective practices in place. Do you have any tips on how to improve this conversation? Didn't even cover their nose with a mask, not sure what to do. I know we had a separate question come in on email from another patient that is post-op, had an appendectomy, and they have to go in for post-op every once in a while, and their doctor isn't taking proper precautions, they believe. What can an individual with EDS or HSD do, especially during these COVID times, that can make sure they're protected if everybody around them isn't as on top of it as they are?
boy, you really don't want to see those medical professionals not taking all the precautions that they can, though I do understand that PPE equipment is scarce at this time. What I would recommend is that you have a conversation with the front desk people, their nurse, or with the doctor themselves prior to going in. Or if you get there and that's when you're seeing that they are not using universal precautions, then say, I do not feel comfortable unless they use masks or gloves or whatever it is that you feel they need to be doing to make you safer. This becomes a question in particular if you have any cuts or open wounds. For instance, in the case of a post-op, if there's an incision that still hasn't closed, you really don't want people that may be infected to be breathing on your open incision, for example. And so saying, I'm sorry, I cannot allow you to examine me until you have gloves on, until you have a mask on or some facial covering, or whatever it is that you feel you need to be safe, within reason, of course. We can't require every doctor to come in a biohazard suit, but within reason.
Absolutely. Thank you so much, Shani. And our 2017 conference is still on our YouTube page. I've dropped the link to Shani's presentation in the chat, so make sure to grab that link before we end today, just so you can have that and look at that as well, because it is one of the better presentations. Definitely helpful. And the last one we're going to go with today is going back to apps. Are there apps specifically designed to track GI symptoms that you are aware of? Or are there good apps that encompass good GI symptom tracking?
Mm-hmm. I know that there are excellent apps for gastrointestinal issues and all kinds of issues. I'm afraid that I'm still a pen and paper kind of gal. And so not a user to be able to say which one's best.
Alrighty, thank you so much, Shani. But that is unfortunately all the time we have for today. You've provided a ton of really important information that can really make a difference in the lives of all of our community with EDS and HSD. And there was some really great advice in there on how we can use our doctor's appointments to our benefit. I think too often we're scared of what's going to come out of doctor's appointments. We're scared we're not going to remember things with brain fog. But the tips and tricks you gave today are really amazing and really great to support us to not have to deal with those extra little things that are bothering us when we go to our appointments. If you would like any more information about anything that was presented today, please check out our website for more resources and information. Like Shani said, give our helpline a call or an email, and her and Rebecca will get to your questions. Check out that link that we posted in the chat for Shani's previous session at the 2017 conference. That's really useful. And sign up for our newsletter if you haven't already. It's a really good source for up-to-date information and upcoming events. Now, speaking of upcoming events, our next webinar will be tomorrow, April 30th at 2 p.m. Eastern Time. We have Crystal O'Loughlin joining us to talk about the impact that stress can have on caretakers of individuals with chronic disorders. You can look out for that sign up for our next webinar on our website and our various social media platforms. Now, technology permitting, I know a few of you have asked this. This webinar should be available on our YouTube channel and our website within the next week or so, barring any technical difficulties and issues with post-production. Now, if you found this webinar helpful in any way, please consider hitting that like button once it's available on YouTube and subscribe to our channel so that you can be alerted to when we're uploading our next videos. Once again, thank you so much, Shani. As usual, you are a fantastic resource for our community, and I hope that you and everyone that joined us today continues to stay as safe and as healthy as they can.
Thank you so much.
Have a great day, everybody.